Hi, I'm Dr. Patrick Boyett with OrthoSports Athens. I want to talk to you a moment about growing pains. We see growing pains quite often in our office. Patients come in, and the two most common types of growing pains that we see in the office are pain in the anterior knee in a child from the age of about 7 to about 14 years old, and also in the ankle, most specifically at the heel site. And these are very common problems that occur in this age group. And what really happens with that, when we say growing pains, what we're really meaning, there's two diagnoses. In the knee we call this Osgood-Schlatters disease, and in the ankle we call it Severe's disease. They're very similar. In children who still have growth that is occurring, the bones have growth plates, and the growth plates have a layer of cartilage that will eventually, as they mature in their skeleton, that will become hard bone. But during the growing phase, that type of cartilage type bone that makes up the growth plate is susceptible to certain types of injuries. And in places like in the knee where the quad tendon attaches to the tibial tubercle, that can cause a pull. The way tendons grow, they really accommodate to the length of the long bone. So as the long bone gets longer and grows, the tendon stretches and accommodates that length. And where the tendon attaches over this growth plate, oftentimes it can put a strain on it and pulls the growth plate. So if a kid goes through a growth spurt at age 12 years old, then it's not uncommon at all for them to begin having knee pain in the front. The knee pain is very typical in that it hurts in the front, it's tender to touch, it's worse with activity, and it's usually not initiated by any type of trauma. We see the same thing in the ankle, where the Achilles tendon comes down the back of the ankle and attaches to the heel bone. There's a growth plate there, and young boys are very susceptible to this. I've got a picture here to show you. If you can see this, this is an x-ray on one of our digital films, and this green line that I've drawn, just to make it a little more obvious to you, represents the Achilles tendon. The Achilles tendon can be seen on the x-ray faintly, but just to make it for better illustration purposes, I put a green line here. If you see, there is a line between this portion of the heel bone and this portion of the heel bone. That line is a growth plate, or the medical term for that is a physis. And where the Achilles tendon attaches to the heel bone, if the Achilles tendon is tight, then it puts a strain across this growth plate. And so that then interprets into ankle pain for that child. So the treatment for this oftentimes is stretching the Achilles, icing it when it's tender and painful, and sometimes modifying shoe wear is very helpful. So if you're interested in those diagnoses and want to learn more about it, I would encourage you to go to the internet, Google Osgood-Schlatters disease if it's knee pain, or Severe's disease if it's ankle pain. We'd love to share our thoughts with you at OrthoSports Athens if you want to learn more.